Welcome to another interesting case. This is 80 years old patient with the current exam on top and the exam 5 months earlier at the bottom. The initial exam has shown areas of the tissue loss, gliosis, as well as contrast enhancement in the medial parts of the right occipital lobe. Similar changes have been noticed in the right lateral parts of the frontal lobe at the level of inferior frontal gyrus, also with some small contrast enhancing areas. It has been stated in the original report that the location of those areas is strongly suggestive of the status post recent infarctions, not acute but subacute to elderly infarctions. This case of the posterior cerebral artery territory. However, how would we describe the contrast enhancing areas? We have performed the SWA sequences, which are very sensitive for hemosiderin, the blood products that show hemosiderin deposits in this same area. Also in the frontal lobe, you can see the cortically. And it has been suggested that most likely it is the hemorrhagic component of the infarction that is often what you can see, that is producing these contrast enhancing areas that correspond with a blood-brain barrier that is still present. With the follow-up exam 5 months later, we can still see the contrast enhancing areas occipitally, but somehow the volume of these areas, as you can see, has diminished. You can also see it here that there was a little bit of fluid because of necrosis of this tissue, and this is resorbed. Only the contrast enhancing areas remain. As well, we can appreciate the detailed anatomy on those zoomed in coronal flare sequences, when you can see some tissue left with edema and now tissue loss in the same area. So doctors asked if there are signs of cerebral amyloid angiopathy that we don't see any other hemorrhages. So in this case, we see evolution of the hemorrhagic infarcts occipitally that show contrast enhancing that is corresponding with the persistent blood-brain barrier. The important lesson is that the follow-up exam is showing the confirmation of our findings that has been the hemorrhagic component. If you like this type of cases, consider reviewing my other cases and subscribing. Thank you for watching. I see you in the next one.